Okay, dear students, let's see some of the questions on abnormal placenta as well. Okay, so question number 10. Okay, so what this question says: if a small part of placenta separates from main placenta but remain connected with the blood vessels, then it is called. Okay, so there is a small part of placenta and main placenta, and they are remain connected with the blood vessels. They are remain connected with the blood vessels. So that kind of placenta is called as the host. Okay. So option A is a placenta spuria, option B is a placenta bilobata, option C placenta secundariata, option D circumvallate placenta. Okay. So think and okay tell the answer. So here first one is placenta spuria. Okay. So what is this placenta spuria? Here the main placenta, this is the main placenta and small part of the placenta. So when the main placenta and small part of the placenta, they are not connected with the blood vessels. When they are not connected with the blood vessels, they are present but they are not connected with the blood vessels. This is known as a placenta spuria. This is known as a placenta spuria. Okay. So when there is a part of main placenta and a part of a small placenta, but when they are not when they are not connected with the blood vessels, then it is called as a placenta spuria. Okay. Then what is meant by placenta bilobata? Placenta bilobata means what here? There is a two equal sizes. There is a two equal sized placenta here. Okay. So two equal sized placenta. They are two equal sized placenta. They are connected with the blood vessels. Okay. They are connected with the blood vessels. So this is known as a placenta bilobata. So placenta bilobata consists of two equal sized placenta, and they are connected with the blood vessels. Okay, there are two equal sized placenta. They are connected with the blood vessels. It is called as a placenta bilobata. This is called as a placenta bilobata. Next, what is the placenta secundariata? So placenta secundariata, it consists of one main placenta, that is big placenta, and one is small placenta. Okay, so it consists of placenta secundariata consists of main placenta and a small part of placenta, but they are connected each other. They are connected each other by the blood vessels. These placenta. So the main placenta. This is the main placenta, and this is a small small part of placenta. Small part of placenta. Okay. So main placenta and small part of placenta, when they are connected with each other by the blood vessels. So these are the blood vessels. By the blood vessels, then it is called as a placenta secundariata. Okay. Now what is a circumvallate placenta? Okay. Circumvallate placenta means so all of you know that okay. So here the placenta. Okay, this is the placenta. The placenta consists of this side is called as this is a maternal surface. Okay, and here is a fetal surface. This is a fetal surface. Okay, this is a fetal surface. So here when the fetal surface is more than when the maternal surface, what happens here? When this maternal surface it starts encouraging the fetal surface, and reducing the fetal surface, then it is called as a circumvallate placenta. Okay, so what happens here in circumvallate placenta here? So this entire placenta. Okay, so here there is only fetal surface is very less. This is a fetal surface which is very less, and this maternal surface is completely encourages the fetal surface. Okay, and it increases its surface area. Okay, and this kind of placenta is known as a circumvallate placenta. Okay, in circumvallate placenta, what happens here? The maternal surface of placenta is greater than the fetal surface. It try to encourage the entire fetal surface. Okay, and leaving less surface for the fetal surface. Okay, so this is known as circumvallate placenta. Okay, so here the question is, if small part of the placenta separates from the main placenta and remain connected with the blood vessels, it is called as a placenta secundariata. Okay, so answer for this one is a placenta secundariata, where the main placenta is connected with the small placenta. Okay, here the placenta secundariata. Okay, placenta secundariata consists of main placenta and a small part of placenta. They are connected with the blood vessels. It is called a placenta secundariata, and main placenta with the small placenta. When they are not connected with the blood vessels, it is called as a placenta sporia. And what is the placenta bilobata? There are two equal size placenta. They are connected with the blood vessel. That is called as a placenta bilobata. And circumvallate placenta is the one where maternal surface, okay, it try to actually the maternal surface and fetal surface are equal. But here what happens here? The maternal surface will try to encroach the fetal surface, and it is complete. The fetal surface is completely surrounded by the maternal. Fetal surface here. Fetal surface is completely surrounded by the maternal. So this is the maternal surface. Okay. So this maternal surface is completely surrounded the fetal surface, and a ring is formed here. Okay. So this is why it is known as a circumvallate placenta. Okay. Okay, dear students. Let's see next questions. Question number 11. If placenta is attached superficially to myometrium, then it is called as option A placenta accreta, option C placenta increta, option C is placenta percreta, and option D is none of the above. Okay. So here actually this uterus, okay, this is the uterus. This uterus consists of 3 layers. Okay. So what are the 3 layers here? That is this. Okay. One layer is this layer is called okay. So here this layer card is called endometrium. Endometrium. Okay. Where you can see the space between the blue and red. Okay, this is called as a endometrium, and this is a myometrium. This is a myometrium. Okay, this is myometrium. Okay, myometrium is there is a, you can see this one, this layer. Okay, the middle layer is called as myometrium, and this layer it is called as a, what is called, this is a serosa. Serosa. Okay, so there are 3 layers. Okay. Okay, so just I'll make a myometrium with a color red. I'll make this is myometrium layer. Okay, myometrium layer is I made a color red. Okay, so this is a myometrium layer, and here this one is an endometrium. This layer is a endometrium layer. Okay, this layer is endometrium layer. Okay, and this layer is last layer. This layer is a serosa. Okay, so usually the placenta has to attach. Okay, so this placenta has to attach to the endometrium. It has to attach to the endometrium. The placenta has to attach to the endometrium. Okay, that is the deciduum of the placenta. So this is normal. Okay, the placenta has to attach to the endometrium. Okay, so when the placenta that attaches, okay, to the superficial, okay, when the placenta, okay, so when the placenta that attach to the superficial, layer of the myometrium, it is called as a placenta accreta. Okay, so when the placenta that attaches superficially to the myometrium, actually should not attach to the myometrium. Okay, so the placenta supposed to attach to the deciduum of the uterus, that is the endometrium of the uterus. That endometrium of the pregnant uterus is known as the deciduum. So the placenta has to attach to the endometrium of the this one uterus, that is the deciduum of the uterus. But when the placenta that attaches, okay, it crosses the endometrium and attaches to the superficial layer of the myometrium. When it attaches to the myometrium superficially, it is known as the placenta accreta. Okay. Next, what is the placenta increta? In this placenta increta, the placenta attaches deeply into the myometrium. Okay, that is when the placenta that attaches deeply to the myometrium. Okay, it does not cross the myometrium, whereas this placenta, it attaches through the decidua and into the myometrium. It attaches deeply to the myometrium. When the placenta that attaches deeply to the myometrium, it is called as a placenta increta. Now, what is the placenta percreta? So, placenta percreta is one way where what happens here, the placenta attaches, okay, and it crosses the myometrium. And then it is attached to the serosa. Okay, then when the placenta that attached to the serosa layer of the uterus, okay, beyond the myometrium, when placenta is attached, it is known as the placenta percreta. Okay. Okay. So this placenta accreta, increta, and percreta are the one which causes failure of placenta to separate from the uterus, and they can be the cause for the postpartum hemorrhage, PPH. Okay. So Here, the question they asked is, if the placenta that is attached superficial to the myometrium, it is called. Okay, when the placenta that attaches superficial to the myometrium, it is called as a placenta accreta. When placenta that attaches deep to the myometrium, it is called as placenta increta. When placenta that attaches beyond the myometrium, it enters into the serosa layer of the placenta. Okay, serosa of the layer of the uterus, then it is called as a placenta percata. So answer for that one is a placenta accreta, where placenta is superficially attached to the myometrium. Okay. Okay, dear students, let's see next questions. Question number 13. Which type of abnormal placenta causes vasa previa? Okay. Option A, placenta subcingulata, placenta bilobata. Okay, velamentous insertion of cord, and option D is a circumvallate placenta. Okay. So now first we will see what do you mean by vasa previa. Okay. So vasa previa means what happens here? In this vasa previa there is a rupture. Okay, this is the placenta. Okay, suppose this is the placenta here. Okay, this is the placenta and here is the umbilical cord. Okay, so when this umbilical cord rupture takes place, and what happens here? This is a baby, this is a fetus. Okay, so here the umbilical cord has attached, which has been ruptured. When the umbilical cord is ruptured, and what happens is fetal blood starts. Okay, so fetus blood is coming out. Okay, when the fetus blood is losing. Okay, when there is a fetal blood is coming out of vagina. Okay, where we cannot differentiate a maternal blood and fetal blood. Okay, so this condition is called as a vasa previa. Okay, in what happens in vasa previa, there is a rupture, premature rupture of this umbilical cord, and there is a fetal bleeding. Okay, fetal bleeding. The blood is the blood is coming out of the fetus and it is losing. Okay, so because of this, the fetal death can also happen. So this is known as a vasa previa. Okay, so in which type of abnormal placenta this vasa previa occurs is the question here. Okay, so now what happens here? There is a one condition called, that is velamentous insertion of cord. Okay, so in this velamentous insertion of cord, what happens here? So this is a placenta. Okay, here is a placenta. This is a placenta. Okay, so this here in the velamentous insertion of cord, what happens here? The umbilical cord is not directly attached to the placenta. Okay, instead it is attached to the, here there is a fetal membrane. Okay, here there is a fetal membrane. So what happens here? The umbilical cord is attached to the fetal membrane. Then the branches of a fetal membrane, they are attached to the umbilical cord. The branches of this one is attached to the this placenta. Okay, so here in case of velamentous insertion of placenta, the umbilicus is not directly attached to the placenta. Instead, it attached to the membrane, fetal membrane. Then the umbilical cord branches. Okay, they will go and attach to the placenta. Okay, so because of this, what happens here? When the baby is, for example, the baby is now like this condition is here. Okay, so whenever there is a rupture of membrane takes place, what happens here? There is a rupture of all these vessels will take place. Okay, whenever there is a rupture of membrane, there is a rupture of all these vessels also take place. So because of this, what happens here? There is a heavy bleeding of blood from the fetus will take place. Okay, heavy fetal blood bleeding will take place. So because of this, what happens here? There is a chance of a fetal death can also happens. Okay, in the velamentous insertion placenta. Okay, so I have already told you, in velamentous insertion placenta, the umbilical cord is not directly attached to the placenta. Instead, it attached to the membranes, and then from the membranes, the many branches will go and attach to the placenta. So because of this, whenever there is a rupture of membrane take place, so due to rupture of membranes, and as these umbilical cords, all vessels are attached to the membranes, these membranes are also get a ruptures, and all these umbilical cords or vessels are also get ruptured, and because of this, there is a heavy blood loss is taking place from the fetal. Okay, there is a heavy fetal blood loss will take place. So because of this, what happens is the fetal death can also happen. Okay, so that is the reason why in case of velamentous insertion of placenta, we will suggest the patient to undergo LSS, lower segment cesarean section. Okay, so which type of abnormal placenta causes vasa previa? It is a velamentous insertion placenta. Okay, so already I have discussed about the placenta second curata. So that is placenta second curata, the main placenta and small part of placenta, they are attached with each other with a small vessels. Okay, when the main placenta and small placenta, when they are attached with each other with the blood vessels, it is called as a placenta second curata. So what is placenta bilobata? Already I have told you that there is a two placenta are there. Okay, so two equal size placenta. So what is the placenta bilobata? Two equal sized placenta. So when two equal sized placenta, okay, so they are attached with each other with the blood vessels. They are attached with each other by the blood vessels. It is called as a placenta bilobata. And circumvallate placenta means already I have discussed, that is the fetal, the metal surface of placenta, it starts encroaching the fetal surface, and gradually the fetal surface okay, decreases and metal surface will increases. Okay, so what happens here? This is a fetal surface. This is a fetal surface and this is a maternal surface. Okay, so maternal surface is gradually it is encroaching the fetal surface, and entire surface of the fetus is acquired. Okay, majority of fetal surface is acquired by the maternal surface. Okay, and a ring is formed here, so that is why it is called as a circumvallate placenta. Okay, so this is all about this question. So which type of abdominal placenta causes vasa previa? So it is a velamentous insertion placenta where, okay dear students, let's see next questions. Question number 12. When placenta is developed, okay, when placenta is developed at the lower segment of uterus, then it is called as, then it is known as option A placenta megali, option B abruptio placenta, option C bilateral door placenta, option D is a placenta previa. Okay, so what happens here? Here the uterus, okay, this is a uterus. So here the placenta should be attached, okay, usually at the upper part of the uterus. The placenta should be attached to the at the upper part of the uterus. Okay, so when the placenta that is developed at the, this is known as upper segment. This is known as upper segment, and this is known as the lower segment. Okay, lower segment, that is towards the cervix. So when placenta that develops, okay, it attaches and develops at the lower segment of the uterus, then it is called as, it is known as, okay. So option E is a placenta megali. Okay, so what is placenta megali? Placenta megali means the thickness of, okay, normal thickness of placenta is 2.5 to 4 centimeter. Okay, so when the thickness of placenta, if it is more than 4 centimeter, it is called as a placenta megali. It is called as a placenta megali. So placenta megali, okay, normal thickness of placenta is 2.5 to 4 centimeter. When the thickness of placenta that goes beyond 4 centimeter, it is called as a placenta megali. Okay, in which condition usually this placenta megali is present? This placenta megali is present in the case of diabetes mellitus, twin pregnancy, okay, and Rh negative pregnancy. So in this condition there is a placenta megali, you can see. Okay, but that is not a question here. They have asked where the placenta that is developed at the lower segment of the uterus. Okay, here the placenta should be developed, okay, at the upper part of the uterus, but it is not developed in the upper part of the uterus. It is developed at the lower segment of the uterus. Okay, so when the placenta that develops at the lower part of the uterus, at the lower segment of the uterus, it is known as a placenta previa. It is known as a placenta previa. Okay, when placenta that is formed at the lower segment of the uterus, it is called as a placenta previa. Okay, it is one of the cause for the postpartum hemorrhage. Okay, so that is the reason why we have to take care of this. We have to identify, and patient should be advised for undergoing cesarean section. Okay, now, so all of you understood what is the placenta megali and what is the placenta previa. Okay, you have understood what is a placenta megali. Placenta megali means when the thickness of placenta is more than 4 centimeter. Okay, so normal placental thickness is 2.5 centimeter to 4 centimeter. When the placental thickness, if it is beyond 4 centimeter, it is called as a placenta megali. It is seen in a condition like a twin pregnancy, okay, mother with diabetes mellitus and Rh negative pregnancy. Now, what is placenta previa? Already you know that when the placenta that develops at the lower segment of the uterus, okay, so then it is called as a placenta previa, okay, which is a main cause for the bleeding after the delivery or after the birth of the baby, okay, postpartum hemorrhage. Okay, and next, what is this abruptio placenta? Abruptio placenta. Okay, so now we'll discuss about the abruptio placenta. So this is the uterus. Okay, so here the placenta is attached. Okay, this is the placenta. So what happens here? This placenta is attached by here the blood vessels. Okay, so when the placenta has to be separated at the third stage of the delivery. Okay, so what happens here? The placenta should start separating from the uterus at the third stage of the labor. So what happens here? When there is a premature separation, when the placenta that separates before the third stage of delivery. Okay, so after the 28 weeks of pregnancy, okay, if prematurely if the placenta starts separating from the wall of the uterus, from the deciduva, then it is called as a abruptio placenta. Okay, so abruptio placenta is the one, it is a premature separation of placenta from the deciduva, okay, or the wall of the uterus. When that happens, it is called as a abruptio placenta. Okay, and what is this battledore placenta? Battledore placenta means it is abnormal placenta here. Okay, this is the placenta. Okay, this is the placenta. When the umbilical cord, okay, the umbilical cord should attach at the center of the placenta. When the umbilical cord that attaches at the margin of placenta. Okay, so this is the placenta, this is the placenta, and this is the umbilical cord. This is the umbilical cord. So when the umbilical cord that attached to the margin of the placenta, actually the umbilical cord should attach to at the center of the placenta. When umbilical cord that attached to the margin of the placenta, it is called as a battledore placenta. Okay, so the answer for when the placenta that is developed at the lower segment of the uterus, then it is called as a placenta previa. It is called as a placenta previa.